Well, hello everyone. This is David Ajibade, and I'll be your host tonight for uh, what will prove to be a very fascinating webinar, given also by a very fascinating person. And of course, we're speaking about Helen Irlen, and I know many of you are on tonight because she sent you an email letting you know about tonight's presentation. Now, if you are watching this if you're watching this as a recording, just remember you may skip this introduction by clicking on the sliver to the right of my video, and then there's a black sliver that goes all the way from the top to the downwards, and then you can click on that, and then you can go on to the next chapter, which is when Helen will start her presentation. Not that I like being skipped over, but I guess everybody wants to watch what they want to watch. Now, there will be replays available, and many of you have also have already bought the replays. In addition to the replays, let me click on the specific video right here, Children's Brain Health Series B. There are a couple of MDs who have talked about autism and the other modalities and what really it's all about. And our goal with these webinars, and I'm going to get to that in a minute, but our goal with these webinars is to give you as complete a picture of health as is possible, and also as complete a picture of disease or illness or whatever condition, that's health challenge that you're dealing with. We want to give you that 360-degree viewpoint so you can see all the angles that you can use to deal with it. And there is no one single formula that works 100% of the time. That's why it's good for you to see all the different ramifications. Again, my name is Dr. David, and Sherry Platt is my partner. She's actually working with Helen behind the scenes, getting her ready for the presentation. Now remember, Helen cannot come on until I come on first, and then there are steps that she needs to take in order to get her slides ready and in order to be ready herself for the presentation. So while she is doing that, and while Sherry is helping her, I'll just keep you entertained as much as I possibly can. Let's see, what else do I have to mention? Okay, that is our goal, to give you the best information possible. Not just the best, but also information that is useful to you. It's no use just to have good quality information. You've got to be able to know how to use it when the time comes. And when we first started, okay. Sherry says don't tell jokes. She's probably heard my nasty jokes. Okay, when we first started with these webinars, boy, I used to drive like 10 miles just to get a good internet connection. Man, thank God those days are gone. But when we first started, I was the one pretty much doing most of the presentations, and the goal was just to give people an understanding of how their minds and their bodies worked. And very quickly we realized that that was not enough. Partially because I was running out of ideas myself, or topics to talk about. But very quickly we realized that to really help people, we also had to show them how to deal with ailments, how to deal with the different things that are plaguing human society today. And we began to look out for people who could help, experts obviously in their fields, who could help talk about these different fields. And that's why the second mission, we had to add that to our first mission, to help people find the most effective modalities, be they nutrition, be they complementary medicine, health care, medical care. I mean, there's the good, the bad, and the downright ugly. And so we want to point people to the good as much as we possibly can. Little did we know how much that was out there. And I tell you, we've been doing this for about 3 years now, and it's just fascinating to me what tools and resources that are out there that can help people. And tonight's presentation is a perfect example. And I tell you, I'm just amazed at what this woman has been able to develop and produce in the 30 years that she's been working on this. And we are so honored that Helen would really agree to come on. And I'm just going to tell you a quick story about how we actually got to know Helen. She's not ready yet, so I can keep on entertaining you. Now remember, please do not make any drastic changes without consulting with your healthcare practitioner. These are not meant to be substitute for standard medical attention. These webinars are to help empower you so that you can better interact with your doctor and better take care of your health when you are, well, you don't have direct access to the doctor. You have a responsibility to take care of your health, and that is what we try to promote, and that's what we try to emphasize as much as we possibly can. All right, the story behind our getting Helen on. Well, we had Dr. Annie Bali do a masterful presentation on ADD, the myths, misconceptions, and mastery. That was way back in November last year. And I mean, that broke all our records. So we had to bring him back, and he did ADD Mastery, where he focused on the treatments, specifically what doctors do to help people with ADD, and showed computerized images of the brain of ADD patients. It's a beautiful, beautiful presentation, and you need to get it. It's on our site. And by the way, you can just click above on the banner above me, and you can click on this on the banner that takes you to our site, where you can obviously you'll see the children's brain health series first. You can also purchase. Okay, well, it looks like we're having a few problems. Well, you might. Okay, she's logging back again. Okay, well, it's just a few slight glitches. That's not to be expected with this system, with the internet. But she might take a little longer coming on. So please be patient with us. Please bear with us. Okay, she's logging back on. All right. Like I said, you may click on our banner, the banner above my video, and that will take you to our site, and you can also purchase the replays and the handouts. All the slides that Helen is going to be using tonight will be available in a handout form at a pretty good deal. Okay, so Annie Bali did his wonderful presentation, and then he has a daughter who had severe light sensitivities, had terrible migraines as a result of light sensitivities. And so, when we had him on and he saw what we were doing, he recommended that we speak to Shoshana, who actually treated her daughter for those those migraine issues, and the method she used to help his daughter was the Irlen Method, by our speaker, discovered and developed by our speaker today. Some of you are not hearing me well. The sound is very low, and I have my volume all the way up. Okay, so maybe there's something wrong with my sound. Some people are having trouble with my sound. All right, let me see if I can come a little closer. Is that better now? Let me know if the sound is better, Shoshana. Okay, this is Shoshana, and Shoshana is actually the one typing in saying that the sound isn't the best. Let me know, the rest of you out there, let me know if the sound is good or bad, and I'll try to make some changes here. Yes, I can barely hear you. She is still working on it. It's coming through okay. Okay, Alberta says it's coming through okay for me. Yes, it is. Hi, it is still low. Heidi says it's still low. Okay, let's see what we can do here. How about now? How's the sound now? No, Heidi means not good or bad. Same. Boy, you guys are hard to please. Okay, let me try again. How about now? The same. It's still low. It's lower now. Someone says better. Yeah. Where's Helen? Okay, Helen is logging back in. Okay, she's gonna be on very, very soon. I promise. She had, I think, much better. Okay. It's louder, better. Shoshana, talk to me. Shoshana, talk to me. Is this better or not better? A little better. Okay. Great volume. Okay. Shoshana's happy with it. That's all I care about. Thank you, Rose. Sounds perfect to me, says Rose. Tina is fading away again. Okay, but looks like it's good. All right. Well, listen. We're just going to hope that Helen's presentation is better. Okay. Gary says sound is clear, but volume is not better. Volume is better. Okay. All right. And so Shoshana obviously worked with Dr. Anibal. You guys keep interrupting me. I'm trying to complete my story here. All right. So anyway, so she did a great job on Dr. Anibali's daughter, and she is fine now, and everybody's happy. So Shoshana has been doing some excellent presentations. She's going to be on next week. This will be her, I believe, third or fourth presentation, and we just can't get enough of her. And hopefully Helen too will enjoy her first experience, and she will give us more and more and more presentations, because our goal is to give you the absolute best in terms of information, in terms of health and wellness, because you really need to know what is good and how to use it. Okay, listen, I have a book by Helen called The Irlen Revolution. I really strongly suggest that you all get this book. And this pretty much, what's the word? It chronicles her search and how she began to find out and develop her method. And it's fascinating reading, I have to say that right now. And I was talking to Helen the other day, and when she went to Australia years ago, she said that they broke records, the Australian TV attendance records, when she went to talk about her method and how it applies to learning disabilities. And it was amazing that so many people had the same problem. I just heard about this 1 or 2 months ago. That's just crazy. 1 or 2 months ago, that's when I heard about this. Never knew there was any such problem as these visual issues. Okay, she's logging back on. Thank you, Sherry. Okay, all right. I'm going to go ahead and read out Helen's bio. I was just going to read the short one before, but I'm going to read the long one now. So those of you who do not know her, you'll get a better idea of who she is. Remember, you can click on the banner above me or the banner above the slides, and that will take you to her website. All right, Helen Irlen. Yes, I accept. Helen Irlen is an internationally recognized educator, researcher, scholar, and expert in the area of visual perceptual processing problems. She is a graduate of Cornell University, which is also where Bernie Siegel, our good friend, attended. Ms. Irlen has been in the field of education for over 40 years. Her background includes school psychologist, licensed child and family therapist, educational therapist, board-certified professional counselor, founder and director of the Adult Learning Disabilities Program, and assistant professor of adult learning disabilities at California State University in Long Beach. She is an instructor in psychology at Cornell University and a research assistant at Cornell. She has been recognized for her dedication to working with children and adults, and is listed in Who's Who in California, Who's Who in... All right. Okay, that's right, Shoshana. Thank you. I forgot. All right. Thank you, Shoshana, again. She has been recognized for her dedication to, she's in Who's Who in Asia and the Pacific Oceans. She was International Woman of the Year, 1999 to 2000. She is International Who's Who of Professionals. She's on the Kingston's National Registry of Who's Who and the Dictionary of International Biography. Wow. Over 30 years ago, research directed by Helen Irlen under a federal research grant studied methods of helping children and adults with reading and learning disabilities. One important discovery was that a subgroup of individuals showed marked improvement in their reading ability when reading using colored acetate sheets. Over the next 5 years, Mrs. Irlen worked on refining her discovery and developing diagnostic, screening, and testing instruments and a method for remediating this problem using colored filters. This breakthrough, called the Irlen Method, has been the subject of 2 segments of 60 Minutes, Good Morning America, 60 Minutes Australia, where, by the way, she broke records, attendance records, BBC News specials, ABC Worldwide News, NBC News, and numerous other TV shows, newspaper articles, magazine articles, and TV documentaries around the world. Her work has been reported in textbooks on learning disabilities in various countries, and there have been over 35 published research studies on the Irlen Method, including brain studies using functional MRI, SPECT scans with Daniel Amen, and VER scans. What is that? I never heard of that. All right. She is the author of Reading by the Colors, and her newest book, just released, The Irlen Revolution, a guide to changing your perception and your life. How a simple method can change the lives of children and adults with LD, ADHD, TBI, dyslexia, autism, headaches, medical conditions, and much more. She is founder and executive director of the Irlen Institute, which has over 174 affiliated Irlen diagnosticians worldwide, and over 7,000 educators have been trained to become certified screeners in the Irlen Method. Many school districts and adult education and literacy programs included screening for Irlen as part of their regular test battery. And if you are a teacher out there, or in head or principal, or in a position over students, I would strongly suggest that you look into this program as well. It looks like she's ready, so I'm going to hand this over to her right now. And Helen, thank you so much. It's been a delight just getting to know you in these last few weeks, and looking forward to hearing your presentation. Over to you. Thank you again.
Hi everybody. Thank you for waiting. I had a little bit of trouble getting on. For some reason, after practicing this a number of times, all of a sudden my computer froze up. But we're here now, and we're going to talk about sensory overload and symptom reduction, not a cure, in relationship to autism. Typically, I like to have questions because it kind of makes you get more in depth in terms of the subject matter, but I'm going to take questions at the very end. So let me encourage you to write down your questions, save your questions, and we will cover all of them at the very end. Okay? First thing I want to talk about is diagnosis, because diagnosis doesn't necessarily tell you the whole story. When we're dealing with areas such as autism and dyslexia and ADD and a whole bunch of other areas, this is not like when you have a medical condition and there's a specific diagnosis and therefore you know exactly what you're supposed to do. In many instances, when we're dealing with subjects such as autism and ADD and dyslexia, they're more symptoms than a diagnosis. And everybody under that category may be different and have a different array of symptoms which need to be handled or need to be addressed. Hopefully one of the things that I'm going to today is introduce you to some of the various symptoms and then concentrate on visual sensory overload so that you'll have an idea of what it is and how to address it and how to tell what behaviors are indicating that sensory overload, which is visual in nature, is a problem for some individuals on the autistic spectrum. By the way, when I'm talking about autism, I am including those with Asperger's, and I may use autistic spectrum or ASD. It's all interchangeable, and I'm not going to differentiate between those with autism and Asperger syndrome, because for visual sensory overload, it really doesn't make a difference what the diagnosis is. Okay, we are talking about various pieces of the puzzle, and one size does not fit all, meaning one method or one treatment or intervention isn't going to be the answer for every individual. Also, when we're talking about symptom reduction, we're not talking about giving a cure for autism. there can exist together. This, when I'm talking about any of these sensory overloads, they're not necessarily the cause, but they sure do contribute to the individual who has autism, contributes to greater difficulties for this individual in terms of their performance and ability to function. So what is some, when you go to conferences, and I've been in the field now for a long time, and it was interesting to start going to conferences where the professionals were talking, and also the adults with Asperger's would talk about their issues and problems. It was interesting to listen to the two, because those with the professionals would talk about it in one way, and the individuals who own the problem, who have the problem, would always be talking about their sensory sensitivities. They're the ones that made the public and the professionals aware of various sensory sensitivities. One is sound, and you can have hyper or hypo. So many times you'll see children with autism covering their ears because it's too loud and it's too much for them and it's too bombarding. At other times it may be difficult because they don't pick up the individual sounds or hear things in the same way that you or I do. Sensitivity to touch is a big issue with this population, with many of the individuals feeling as if a regular touch is like being, bombarded by nails, and it's so painful, or it's so soft that it's irritating to them. Smell sensitivities. Smells can create physical symptoms. They can not just be they don't like them, but actually kick in physical symptoms. Textures is an area that a lot of people are aware of in relationship to autism, where tags and certain types of fabrics are so annoying and so uncomfortable that the individual cannot wear them. And the one that I'm going to be talking about is visual sensory overload, which is light and colors and patterns and high contrast. When you hear me talk about these sensory sensitivities, I want you to be aware of the fact that they don't exist only in the autistic population, that these are all areas that exist across a whole continuum, from normal individuals to individuals with mental illness and individuals with ADD, meaning anybody, anyone can experience these sensory overloads, and they can create the same type of problems with attention and concentration and performance and the ability to function. Interestingly enough, these sensory issues are inherited. So as I'm discussing the sensory visual part of it, and you may be relating to it, you have to think about your loved ones in terms of your children. You can go up generations, down generations, or across generations, because anybody can be experiencing the type of problems that I'm going to talk about. It is not restricted or limited to just those with autism, but there is a huge difference, because those with autism experience sensory overload in a much more severe manner than if you or I experienced the same kind of problem. So for those with autism, it is much more profound. It is much more, creates more significant physical symptoms, and it is much more unpredictable, and it can be very frightening. And I'll explain that as we go on, because one of the things that I want to show you by pictures and by words is what the world looks like to an individual on the continuum who is experiencing visual sensory overload. Now, as far as interventions, there are obviously different interventions depending on the type of problem that the individual is experiencing. So we can have difficulties with food sensitivities that can create physical symptoms, which makes it difficult to perform and to interact. And then there's the DAN protocol. There is gluten and casein diets, but I also want you to make you aware of the fact that there can be many foods that can create problems with behavior or behavior control, and it's not necessarily limited to gluten and casein. I found some individuals who have problems with oranges, so sugar and other kinds of foods can create problems as well. There is sensory integration therapy, working with small and gross motor, and also dealing with tactile sensitivities. And the method and the intervention, though, if it's visual sensory overload, is going to be the Irlen Method. And I'm going to shift now and talk about the Irlen Method. One thing that I want to make you aware of is that we do have an international advisory board, and we have people on it with backgrounds in dyslexia, research, low vision, ophthalmologists, medical doctors, and also autism. So you notice the name Tony Atwood. I'm sure some of you are familiar with Tony and have heard him speak because he travels around the world, although he is from Australia. He's been to the U.S. many times and spoken at many conferences for autism and Asperger syndrome. And I'm sure you've read Tony's books. Okay, let's talk a little bit about in the beginning. How did this all start? My background is a school psychologist, and I worked for years with children who had learning and reading problems. And over the years, it became very obvious that the psychoeducational testing that I did was limited. It did not identify all of the children who had problems. And I knew that because the teachers would then drag me into the classroom and said, your test doesn't identify a problem, watch this child perform, because you're going to see that this child is incapable of performing in the classroom. Or the parents who would say to me, the school has no concern about my child, but what they're not, because the child does well, turns in the homework, what they're not aware of is the fact of how long and how many hours that child is working in order to be able to turn in the work. And I know because I'm working alongside that child. So they're not aware of the amount of energy and effort that is going into it. I've heard this time and time and time again. And luckily in 1980, California State University, Long Beach, received a grant to start one of the first programs at a university level for adults with learning disabilities. And I came on board as the director of the program. And one of the issues for me was just not to be able to remediate or create interventions for these adults but an important issue for me was to be able to do the research, to work with adults who have the language and the capability of explaining to others what their problem was. In the past, we've never studied adults because up until that time, if you had a learning or an academic or a reading problem, you just dropped out as soon as you could. And most often you did not go on to college. So we weren't aware that adults could still have the problems. We somehow had this thought that magically these problems went away and disappeared. They didn't go away or disappear. The individuals who had the problems left the educational system, so they were the ones who went away and disappeared. Interesting, when I first started working with the adults, they said to me, you know, you're the first person who asked us what our problem was for us. What typically happens, and I can say that because I'm a school psychologist and I do psychoeducational testing, is we test and then we tell the person, here's your problem and here's your label. We never go back and say to them, does this make sense to you? Is this real? Is this really what you're dealing with, suffering or struggling with? I turned it around and I asked the individuals themselves what their problem was and what it was like. I found out that I had to learn how to ask the questions in the right way to be able to get information. When we first started looking at the printed page and what the page looked like, you can't ask someone who has a reading problem, tell me what reading is like, because they're going to just say to you, I don't like it, it's boring. But if you said to that same individual, think about reading at the point where you want to stop reading, how do you feel, how do your eyes feel, how does your head feel, and how does the page look, then we got totally different information. Well, the words are blurry and they move side to side and sometimes they swirl around and I get a headache and I get dizzy. Over the next 3 years, what I did was worked with 1,200 adults to be able to document all the various distortions that could occur on the printed page. And in addition, document the fact that along with seeing these distortions, they were experiencing some type of pain, strain, or discomfort. The research was published and put out there, and we were getting calls from people who didn't necessarily have a reading problem, who were saying to us, hey, I don't have dyslexia or a reading problem, but I experience the same thing. Can I be helped by the Irlen Method? And I'll talk to you about how we get rid of the distortions and the discomfort later on. In addition, one day we got a call from an adult who said, I understand all of the distortions that you're reporting on the printed page, but you need to know that they happen for me in the environment. And this adult had Asperger syndrome. And she wanted to be able to try the Irlen Method and to be able to get colored filters that hopefully would make her environment clear and stable and make things comfortable for her so she would be able to see things as they actually are. Don Williams documented in her various books in very wonderful language and detail how distorted her environment is. And let me recommend, if you haven't read any of her books and you work with individuals on the autistic spectrum, that you should read Nobody Nowhere or Somebody Somewhere, or The Color Like the Blind. In one of her books, she talks about having to look at people but not really being able to see them clearly enough to be able to identify them by how they look. Instead, she says, I have always known that the world was fragmented. My mother was a smell, and my father was a noise, but nothing. And my brother was something that moved around, but nothing in my environment was clear enough for me to see, and there was colors and sparkles, and that's what I would see. So what she's explaining to you here is the fact that the colors and the sparkles in her environment took over, and everything else was behind it, and she couldn't see through her colors and sparkles to know what it was about. Donna's kinds of problems we were dealing with, and it took us to look up from the printed page and understand that these kinds of problems were existing in the world, especially for those on the autistic spectrum. When we deal with the normal population, they report that they have problems with depth perception and seeing things, but not as severe and to the same extent as the distortions experienced by those on the autistic spectrum. So let's go back to vision, because that's what we're all talking about. And I want to talk to you about the visual system, because most people, including optometrists, think about the visual system in terms of how the eye sees things. But it's not the eye. It's the brain that sees and has to interpret the information. And we are basically receive most of the information in terms of how we process our environment Most of that information is received via the eye, and it's visual information, 70% of it. And an important quote is what's here is you actually see, not what's out there, but you see what your brain wants you to see. And not always. Let me give you an example so you can kind of understand the concept that not always what you see is what's really there. Think about optical illusions. Optical illusions are created and they actually stimulate a part of the brain in a way that it changes the color, and it creates distortions when you look at it that aren't really there and aren't really happening. We can do it by just creating optical illusions. For individuals who are dealing with sensory overload, it's happening all the time, every second, and every moment of their environment, and they cannot make it change or stop it from happening. So, if you've never experienced an optical illusion, I want you to take a look and stare at the middle of this picture. And as you keep looking, my hope is the fact that as you're looking at it, things are starting to move and to swirl. Now you know that they can't be swirling, but they are actually swirling. Here's another optical illusion, and this time I want you to move in and out and see what happens and how your brain is perceiving and the changes that are happening as you look at this optical illusion. So everything occurs in the brain. Everything we do is processed in the brain. It is all brain-based, and our brain is the most important organ we have, but it's also the most complex and the least understood. But yet the brain controls everything we do. It controls our thinking and our feeling and our acting. And when there's a problem, for those with autism, they can experience a world that looks like an optical illusion to them. And again, back to the fact that this does underlie a large percent of issues that are being dealt with for those on the spectrum. Says one mother, "I've always felt that my son's sensory disabilities were his primary problem, and that he's living in a world of misperception." There's a study that was done by the Geneva Center for Autism in Toronto, Canada. They're probably one of the largest centers for autism. They have a huge population that they've worked with over the years, and they sent out a questionnaire to everyone that they have ever worked with on the spectrum and said to them, "I want you to tell us what type of sensory overload you're experiencing, visual or tactile or smell or taste or touch." Interestingly enough, 81% of those with autism reported that they had a distorted perception. Some of them even sent in examples of how stairs look like they're just steep and they don't go in, how they move on them from side to side, how they change and distort. There are certain triggers that will create more problems for those who have this type of sensory sensitivity. Lighting being the first one. Yeah, you have triggers and most people are aware that sunlight's a problem. What they don't realize is that the brain interprets sunlight, bright lights, headlights at night, actually all lighting in the same way, and it will trigger the same type of problems and symptoms. So will glare, certain bright and fluorescent colors, patterns, high contrast, meaning black on white, doing any type of visually intensive activity. And looking at somebody is a visually intensive activity. You're looking. So if your eyes are open, you're experiencing sensory overload. And the only way you can change that is to close your eyes or shut it down or stay in a dark room. When we started working with the autistic population, we never touched again a child or someone who didn't have language until we had worked with the adults who had the language to report to us what their problem was like, what it was like for them in their environment, and then be able to track for us the changes that occurred with the Irlen Method. Some instances, you don't know that you have a problem until you can change it and to make it better. And that improves the reporting of what it was like. And the thing that the adults said to me time and time again as they went through this experience is the fact of, we're tired of people trying to make us look normal. We're tired of people trying to change our behaviors so that we fit in and so that they feel less uncomfortable with us. Instead, why don't people try to get rid of the problems that are causing these behaviors? One of which is visual sensory overload. And I'll explain to you how a lot of their behaviors are used as coping compensatory methods to block out the stimuli that is so bothersome for them. Again, another quote for someone on the autistic spectrum. Faces look like they are in pieces, strange and fragmented. Faces, by the way, are the most difficult thing for individuals with autism to see, and I'll show you some pictures of that. Anyway, I see colors everywhere that are flickering and flashing or glaring neon like blinding lights. Things come in at me, and I get startled and scared. I just want to retreat from the chaos because it's just so overwhelming. So when you have sensory overload, it can affect many areas of functioning. Social interaction, communication, listening and looking, sensory integration issues, behavior control, being able to do certain academics, small and gross motor skills, and creating light sensitivity or creating physical symptoms. It was interesting when Donna first started wearing Irlen spectral filters. Before she wore filters, her Irlen filters, if someone asked her a question, she would say, you need to tell them they need to type it out first, you need to be able to read it, you need to be able to type out her response. I've had individuals with autism who have Asperger syndrome have come in, and they have typewriters so that they type their responses, push a button, then it verbally responds back and tells me what has been typed. For these individuals, once they had the Irlen filters, they were able to just communicate and talk and respond because the brain wasn't so overloaded, and they could then think, pull their thoughts together, and respond to questions and communicate with individuals. Big change. This is a picture done by a child in Australia who's autistic and sent it to me after she was wearing her filters so she could draw for me what her world was like with and without her Irlen filters. And you can see that she doesn't see lots of things disappear and aren't there in her environment. So just a simple thing like stepping into a bathtub is absolutely frightening because she doesn't know and can't tell that there's waters and bubbles and where the bathtub is. Once she has her Irlen filters, it's all there. It's not frightening for her. What she sees is what's really there. When you can't see things accurately, when you're not sure of what they are, you may use certain compensatory behaviors such as rubbing them, smelling them, touching them, tasting them as a way of understanding what they are. So those are, again, coping behaviors that helps the individual with autism process and understand their world. And again, those behaviors can disappear once they can actually see things accurately. I worked with Alex, and Alex has Asperger syndrome. And Alex walked and would take her shoes off because she liked to walk barefooted, because that gave her a feel of really what it was like. Otherwise, she couldn't tell if the floor went up or down, if there were cracks to it. She didn't see it. And the suddenness of the change when her eyes told her one thing, but her body told her something else was very frightening. But at least if she had her shoes off, she could tell what was going on. And then she wrote me and said, I don't have to walk around barefoot anymore once I'm wearing my Irlen filters. Here's a picture again, sent to me by someone after they wore their filters, showing that people all look alike. Eyes are white, teeth are white, and they disappear. And the faces distort, and they can't tell whether they're alike. Everybody looks like a pig, and she has blind spots. And here's what she sees now that she has her Irlen filters. And she can now tell people apart, and she can see their eyes and their nose and their faces, and she can see facial expressions and gestures, and that allows her to be able to read body language and to understand better what people are saying. Again, this was an interesting picture. There's a whole bunch of different distortions, and that's why I'm going kind of at length and showing you different pictures, because for me it was fascinating. I couldn't imagine what the world must be like for those who have these kinds of distortions in their environment. And I've heard it reported with my other populations, and it was never to this extent. So the pictures created more of an image than the words did for me. This is a bus. Can you imagine if this was traveling rapidly and you were supposed to figure out what it was? Sections are missing, things seem to merge and melt together. It's not what it seems, and it doesn't stay stable or static. This child is, I think she's 11 years of age, and this is her world. It's a combination of flickering colors and sparkles, and it doesn't matter whether she's looking at you or looking at things in her environment or trying to read things on a printed page. Now, there is a connection between seeing and hearing that you need to know and understand and recognize what that sound is, and you do it initially by seeing it. Let me give you an example. I'm going to go back to Alex because it was fun to work with Alex. We were at a conference, autism conference, and I decided to tint her there. And for the first time, when she put up her Irlen filters, there was somebody going by with a cart with glasses and ice in it, and she was totally startled and jerked around to look and said, "Oh, that's ice cubes in a glass." She had no idea because she really had never been able to link that sound to a visual image and understand what it was before. The next time he came by, she didn't even think about it. She could figure ground it and reduce that sound because it wasn't important, and then she knew what it was all about. Otherwise, what happens is for many of these individuals, they're not hearing individual sounds. They become muffled or unclear. Some of them report it just sounds like blah, blah, blah to them. And therefore they can't understand what you're saying. They don't see your facial expressions or body language. They can't tell if you're mad or sad or happy when you're saying it to them. And how in the world are they supposed to then respond if this is what it's like for them to try to hear and listen to sounds and language and communication? This is again a quote from someone once they had their filters and said, "I can now sort out which sounds to listen to because I can figure out what noises are important and which don't belong, which sounds I'm supposed to listen to and which I can ignore. I don't panic as often when I hear sudden and loud noises." So that things are now calmer, she's more focused, she can organize her thoughts better, and she can tell what is happening when she listens and what she is hearing. Depth perception is another area that is clearly affected by sensory overload. There's difficulty judging heights and distance and speed and spatial awareness. When the environment is that distorted, you may not have 3-dimension. You may not see everything. You cannot judge heights, you cannot judge distances, and you have no idea of how things really look. Everything looks flat, and everything looks like it's piecemeal and not put together. It's like taking a face and taking every inch of that face and putting just each inch on a flashcard and then going flashcard by flashcard by flashcard. And then somehow you're supposed to piece all of these pieces together and know what it is that you're looking at. Things that move are actually much harder, especially when they're disjointed and pieces are missing to start with. Let me go back into light sensitivity because lighting becomes a critical issue. And I need you to understand that the worst lighting is bright lights, sunlight, and fluorescent lights. The concept that brighter is better is a myth. I heard someone, an ophthalmologist, say, "Does it hurt your ears if somebody whispers?" Meaning dim light is not going to hurt. Matter of fact, it's easier, less stressful, and less distortions for the individual to see things in dim lighting versus in bright lights and fluorescent lighting. It increases the distortions and can create severe physical symptoms. And this is something we may not be aware of because the individual doesn't have the language to report it. Or even within any other population, they don't tell you, and when I ask them questions like, how comfortable is it and what happens under fluorescent lighting, and they say, well, I get a headache and I get a stomach ache. And mom says, well, how come you didn't tell me? The child looks at mom and says, well, you never asked me. I didn't know that I wasn't supposed to get headaches or stomach aches. I thought everybody did. So even when you have the language to report it, you don't know enough to report it. We do know that lighting, especially bright lights and fluorescent lighting and sunlight, for some individuals creates a whole array of physical symptoms. Anxiety, irritability, nauseousness, dizziness, fatigue, headaches, stomach aches, eyes hurt, ache, burn, sting, and I can go on and on. So there's a lot of problems that occur just with lighting itself. Again, another quote from an individual who has Asperger syndrome, talking about how the world is just a jigsaw puzzle and seeing things only one piece at a time. And none of the pieces are joined together. They are moving, vibrating. I have no faces in mind, no details. Nothing is whole. I see one of your eyes or the other, but never both at the same time when I look. I can see blurred colors that are whirling and sparkling. What I see is only hazy colors, pieces, fragments, nothing whole or detailed. In such a fragmented world, I relate to inanimate objects. And again, don't try to cure me by making me look normal. Get rid of my piecemeal perception and make it whole again for me. I want to go into the behaviors because I want to make you aware of the behaviors and the reason behind the behaviors. So if you see any of these behaviors, know that they're symptoms that the individual is experiencing sensory overload. The rhythmic and repetitive behaviors, the self-stimming, the flapping of the hands and the arms, that's used to soothe and reduce the stress, the panic, and the anxiety created by such a horribly distorted, fragmented, and unpredictable environment. The looking in short glances, looking down, sideward glances, squinting and avoiding eye contact can be an indication that they're using those things to actually block out and minimize the environment and in order to try to eliminate the pain and the bombardment from the environment and the distortions that they're seeing. Talked before about feeling and touching and tasting is trying to make sense out of things that they can't tell what they are. And squinting, rubbing, pushing on eyes, and hitting our eyes are just some examples of indicating that the individual is experiencing discomfort or pain or headaches. So what's the Irlen Method? Well, what we do is we want to correct the signal that goes to the brain and normalize it so that the brain now can receive organized rather than disorganized visual information. And we do it using colored overlays and Irlen spectral filters, which are worn as glasses, and environmental modifications. What they do is they put harmony into the autistic child's world. Again, I want to repeat, this is not a cure, and if you're looking for a cure, that's not what's going to happen. But it is going to reduce and eliminate the sensory sensitivities. There isn't one size fits all, there's not one pill, and there's not one color, because everybody's brain is different. Every color that we give out to an individual is different from individual to individual to individual. We actually have to individualize the colors to match the person's brain. Visual information goes from the eye, right, to the brain. When it's converted, it doesn't go as an image or a picture. It's converted into wavelengths of light. And that's what the brain is being flooded with on a constant basis if their eyes are open. And wavelengths of light are just colors. And there are certain of those colors or wavelengths of light that are creating the distortions and the discomfort. But for every individual, it's different. So we actually have to go in, it's like cooking, and go through every single wavelength of light and go, is this a problem? If not, we don't touch it. If it's a problem, we have to find out how much we have to filter it, because if you filter that specific wavelength of light too much or too little, it also can create problems. So you have to get it exactly right. So it's a very fine-tuned process for each individual. When the brain is getting flooded with visual information, this is a VER, and they were looking at what's happening in the brain. There's different ways of looking at it. I thought this one was interesting because if you see here, this is based on the right-hand side, is what's happening in the brain when it's overloaded. The first thing that happens is the signal can't be read because it acts like a flashbulb and nothing is being processed. And it slowly then has to process and finally gets to processing the information just as it needs to stop processing and picking up another signal. So it can't, because it's still processing as the next signal goes on. On this side, you're going to see a normal processing, or how an individual wearing Irlen filters processes it. There's a latency period, that's the black, where it's calm, the brain is ready to receive the information, and then the information is received and processed. And finally, it goes into a rest cycle, ready to process more information. So it's signal by signal. And when that doesn't happen, you're seeing a brain again, on this side, you're seeing a brain that's overactive. This is using a SPECT scan, looking at blood flow. The areas that are white are overactive. They're working too hard. The back part of the brain, right here, that's your visual cortex. Obviously, that's working way too hard and is way overactive. But there are other areas of the brain that aren't working well either. One area would be the basal ganglia. Anxiety and irritability can be affected, and the brain is connected to the spinal cord, so it can kick in physical symptoms anywhere in the body. Just want to talk to you a little bit about Irlen testing. And the fact that even though it's a very fine-tuned process, we're able to do it without the individual. We can do it for individuals who have little or no language. We don't ask questions. They don't have to report things to us. But the one thing they do need to be able to do is, especially for those with tactile sensitivities, they need to be able to wear glasses. So we suggest that you make sure that they can handle glasses by buying some cheap sunglasses, punching out the lenses, and having them practice and wearing them, because there's no point coming in for testing if the person cannot wear glasses. In addition, we don't put everyone who has who's on the autistic spectrum into Irlen filters. So we do some pre-screening, and there are two methods for pre-screening, and you can get onto the website www.irlen.com and look at them. One is the autism questionnaire, where we ask questions to identify whether the individual is experiencing the type of behaviors that indicate the sensory overload is visual in nature. The second one is more interesting. That's called the light activity. And you can use this with even very young children. What you do is you get a room where there's no ambient light. The only light source that's going to come in is what you're going to bring in terms of freestanding lamps. And you're going to have different colored light bulbs, red and blue and green and yellow. And you're going to try having the child sitting in this room, and one day or for a few days you're going to use the red light bulb and do different tasks, whether it's looking or talking or things that are difficult for them and things that are easy for them. And then you switch the next day or two and try another colored light bulb. And what you do is you monitor and record the behaviors and what happens under the different light bulbs, where you colored the environment for that child. If the individual is going to respond or to Irlen spectral filters, what you're clearly going to see is a difference and change in behavior. With some of the light bulbs, things are going to get worse. So you may see more stimming behavior, more finger flicking, less looking. But with one or two of the colored light bulbs, you will see things change and actually get better, and definitely better with one over any of the other colors. It also gives you a very good indication of what behaviors and what type of changes to expect from the Irlen method. So we never want to overpromise. We want to give people a very good idea of what's going to be able to change and what's not going to be able to change before they decide that this is something that they want to do. You can also do modifications in the environment by reducing the lighting, using incandescent light bulbs, and I have to say in 2012 I won't be able to recommend that anymore because you won't be able to use them. You can use colored paper, you can change the brightness on the colored monitor. And again, you can read, this is just another quote by another individual talking about Irlen. You can reach me at www.irlen.com. I suggest if you want to know how visual perceptual distortions affect individuals within ADD population, traumatic brain injury population, concussions, anxiety, panic disorder, Asperger syndrome, dyslexia, then you may be interested in reading my book called The Irlen Revolution, A Guide to Changing Your Perception and Your Life. And that's by me. Okay, I guess I need to read the question out loud. I don't know if you see them on your screen. So the question is, what part of the electromagnetic field play in distorting the nervous system? How old does a child have to be to get Irlen glasses? First of all, in terms of age, it really depends on how severe the symptoms are, because we use behaviors to tell. So even within the normal population, I've been able to test children who are as young as 3, 4, and 5, because when the parent had the child in a dimly lit room, they saw clear differences in the child's behavior, sensory motor issues, small and gross motor issues. And so we can do it very young, but it really depends on the severity of the problem. Is it necessary to have a diagnosis of ASD in order to use the glasses? Absolutely not. That's what I'm trying to say. Not just that for Irlen, these problems are hereditary, runs in families, and it doesn't matter what your diagnosis is. If you're having problems with light sensitivity that creates discomfort, or you're seeing and experiencing a page that is not stable or not clear, or an environment that is not stable or clear, regardless of the diagnosis, this method is going to work. Okay, my grandson was evaluated and determined not to be in the spectrum, but I see a lot of the behaviors that are being talked about here. That's exactly right. That's why I don't, to me, I don't care about the diagnosis as much as I want to get rid of the problems of the symptoms. So you need to look at the problems and symptoms. So if you're hearing things, regardless of what that label is, forget the diagnosis, look at the symptoms. You want to get rid of the symptoms that I've talked about today. David, is that the only question? I'm not sure how to... Oh, okay. Oh, what's a VER? It's a type of brain scan that is done. There's a different type of brain scan, and it has a real technical name. Can a person with auditory processing problems be helped if they also have problems with reading? Auditory processing is a separate issue. Again, that's why I'm saying you need to look at and address each of your separate issues. Auditory processing problems, there are many interventions and therapies that address that issue. It's going to affect reading in a different way, because typically auditory processing problems are going to affect one's ability to do decoding, sounding out words, and sometimes understanding the language when they read it. So that you need to address it, and yes, auditory processing problems address reading in a different way. So you have different sub-skills to reading, and those that are addressed by Irlen are usually problems with flow, fluency, accuracy, the length of time that one can read with comprehension, and comfort or discomfort. Those are the sub-skills that affect reading. A lot of times what we see with those on the autistic spectrum is that they have good reading skills but poor comprehension. And when they're wearing the Irlen filters, their reading actually slows down, but the comprehension comes in. Now, to confuse you a little bit, within every other population, the reverse happens. With the Irlen filters, they read faster and more fluently and with better comprehension. Okay. At what age should an individual be fitted for Irlen filters? At what age? You know what my dream is? My dream is that every child be screened for this type of processing deficit 3 times in their lives. One when they're very young, one in elementary school, and then again in middle school or high school. Because this is triggered and has environmental triggers, it can onset at different times for different individuals. Let me go off of the autistic spectrum and just kind of explain that with those who have dyslexia or reading problems, or maybe misdiagnosed with dyslexia or misdiagnosed as having ADD or ADHD. If they're seeing distortions so that the letters A and E's and O's look alike, B's and D's look alike, the letters are reversing and flipping around, that's going to affect the beginning initial reading skills. And so even in kindergarten and first grade, we can identify and help that type of child. In addition, the children who are very young but already can't stand to be in sunlight tell their parents that it hurts their head or hurts their stomach. Yes, we need to get to those individuals young and even sometimes before they start school. At the other end, and totally other end of the continuum, are those individuals who the print is stable, but the background is so bright that it takes effort and energy for them to keep looking at the printed page, and they manage to get through the K through elementary school either not reading or doing what I call skip reading, reading beginnings and endings, getting in and getting out, but never reading anything through. You can do that. You have good listening skills and a good memory, and you can get by school and not be identified as not reading. They have, and in addition to that, they have good reading skills. They're just not able to utilize those good skills for comprehension or to be able to read for any length of time. Some of those individuals then got A's and B's, and all of a sudden they go to college and they have to read. And all their other strategies don't work anymore in terms of trying to get by without reading, and all of a sudden they hit a brick wall. So there are different times that we're going to be able to identify individuals as having the problem. And we have a number of self-tests on the website. So we have different self-tests if you get headaches, because we work a lot with populations of individuals with chronic headaches and even chronic migraines. Right now we're working with the Marines who are coming back from Iraq and Afghanistan, getting as many as 3 to 4 migraines a day and chronic headaches on and off all day long. And because we're filtering out the irritating part of the spectral band, we can get rid of 100% of their headaches and migraines. So we have one set of questionnaire for those individuals. We have a different set of questions for the individuals who have reading problems or are getting mislabeled and misidentified. They require frequent modification. Okay. Yeah. That's a good question. We have to inform everyone that the lenses are colored, and like fabric and colors in fabric, they can fade over time. So once a year, we require that individuals come in for filter checks. In addition, interestingly enough, hormones and maturation and growth can change a person's brain chemistry and therefore change the color that they need. So children can go through changes, so we watch them once a year. We have individuals, though, who have gotten their filters as adults, and they're still wearing them 10 years later and say they're working just as well as they did at the beginning. But they're educated to now know how things are supposed to look and how they're supposed to feel, so they can tell when the filters are no longer working for them. You see, it's not a cure. No, it is not a cure. Do we see long-term changes? Yeah. Back in 1980, when we started this process, two things occurred. One is the adults said to us, don't make the change and show us how easy and how comfortable things can be if it's going to go away. I mean, that was a real frightening issue for them. And so we held it as research for 5 years to make sure that the changes didn't go away and stayed. We have now, there was one huge long-term study looking at individuals after they've been wearing the filters for 2 years, 4 years, and 8 years. We now have people who've been in the filters since 1983 and are still wearing them, and so we have long-term tracking and saying, yeah, the problems, it calms the system down, it settles the system, and it keeps it that way as long as they're wearing the filters. But what we've seen, which is interesting, is for individuals who have had head traumas or brain surgeries or anything where it's related to the brain and they've acquired these kinds of Irlen symptoms, especially for TBIs and concussions and head injuries and even whiplash, that when they're wearing the filters, it calms things down, it calms the brain down significantly and gives the brain a chance to heal, so that as good as the changes are, they're even better each year thereafter, which is really interesting. Let's see. Are there certifications necessary for practitioners to provide these assessments for the Irlen filters? Great question. I didn't talk about it. Again, my dream is that this method would be integrated into the public setting and the school systems, so that every child who needed this method would automatically be screened and could be provided with overlays, which cost very little for the school system to provide them with the overlays, and once they've done the the training of the professional. So we created a method for screening that can be implemented and built into the school setting. We train a variety of practitioners, whether they're teachers or special ed people, occupational therapists, individuals who work with children and adults who have learning and reading problems, and the variety of other issues that we work with. So yeah, you do have to have some type of educational background. We train psychologists and neuropsychologists and medical doctors. So there's a wide variety. That information is on the website, and so all the information is on the website in terms of how to become a screener, how to sign up for the training. It's 2 days, and what type of credentials you need in order to be trained. So I'm glad you asked that question. In order to be able to do the filters, that's a totally separate, you have to become a screener first and get knowledge, because people don't have the information and knowledge about the distortions and how this affects people. So we require you to become a screener first before you can go on to the next training. Let me see. Do you have to be sensitive to sunlight to have Irlen? Not always. There is for people who are not autistic, there is what's called a self-test for Irlen syndrome, and again, that's on the website. And we look at a number of areas, and you get to check the subskills. So one of the areas is definitely light sensitivity. Another area is inefficient reading. Do you skip words? Do you skip lines? Another area would be, do you get strain, fatigue with reading and needlepoint, looking at the computer, reading on the computer, doing any type of visually intensive activities? Another area is depth perception. Have problems with 3 dimension? Do you have difficulty turning left in front of oncoming traffic? Do you hesitate before you get on and off escalators? People in the car with you, when you have to turn left in front of oncoming traffic, are they always saying to you, turn already? You go, no, I gotta wait, because you judge the distance, so you do lots of right-hand turns. Difficulty reading music, and instead you compensate by memorizing things, or you compensate by looking at the hand movement rather than reading the notes. Any one of these areas can indicate that you have Irlen, and you can be helped. So that's what we're saying is, no, it's not just one issue. That's why we call it a syndrome. There's about 8 separate areas. Sometimes they come together, and someone has problems in every area. Sometimes you only have problems in one area, and it doesn't matter. It also gives you a sense when you take it. The number of yes answers indicates how much energy and effort, extra energy and effort, you're putting in to survive in that area compared to other people. Where and how you can be trained in this method, as I said, visit the website. There's information on training on the website, and I really encourage any of you who have an interest in this and are a professional to please train as a screener so that you can identify children who are having this type of problem. The thing that I've heard over and over and over again is this is one of the best kept secrets. And the last thing we want is for this to be kept as a secret. We want people to be able to get this kind of help. Can an Irlen screener test an autistic child with overlays? Yes, you can, but we're going to also encourage you to use the light bulb and the self-test as a means of identifying, because typically in the autistic population, the distortions are much more severe in their environment than they are on the printed page. But I hear time and time again, my child has good reading skills, but can't function in terms of all the environmental issues that we're dealing with. So you really have to look at the environment in addition to the printed page with someone who's on the autistic spectrum. And again, get on the website, because all this information, when you get on to who we can help, click and scroll down till you get to the population you're interested in, and then it will also give you information as well as the type of self-test. Is there something different than the people that we do not do for our regular population for screening? Well, the autistic population is screened differently, as I said. Okay, we have another question. My daughter spins, flaps, and stims back and forth, moans and groans. I hope the glasses will help her. She is only 3 years old. Might a senior citizen be helped? Okay. Wow, she's moaning and groaning. So what we're picking up is that she really is experiencing a lot of physical symptoms and distortions from her environment. One thing I would try, just to make sure that this is what's going on, is look at the difference in the flapping and the spinning and the stimming and the moaning and the groaning when she's under bright lights and fluorescent lights versus when she's in a room that's very calm and dimly lit. If there is a real difference and calms it down, then yes, this is exactly what is going on for her. Okay, might a senior citizen be helped? Who's starting to lose comprehension. I have a videotape that says you're never too old for Irlen filters, and you have to be over 80 to be able to be on the tape. So we work a lot with senior citizens and realize as you get older, your sight becomes even more important to you because you're less active and you're doing more things that require you to use your sight. And so when there is a problem with your sight or visual processing, it becomes more debilitating for the senior citizen. And the environmental accommodations. Okay, yeah, expand on environmental accommodations. Okay, lighting being the first one that needs to be looked at and addressed. You know, also things like wearing hats and visors when you're outside in bright sunlight. It's hard because it's really hard to filter out your whole environment, and that's kind of what you need to do. In the classroom, we talk to the teachers about modifying the lighting, creating lighting environments that are half lit, that have no fluorescent lighting, using only the natural lighting, and they can see their environment calm down. We talk to them about not using white paper, using soft buff paper or soft gray paper. We talk to them about avoiding patterns. Stripes, plaids, polka dots are really stressful. If you look at times with the autistic child and they start getting mesmerized by certain things, it's because that stimuli is actually changing and doing very different things than what you and I are seeing. And we do know that patterns are a huge problem. Polka dots are terrible and stripes are really bad. So watch what you wear and watch the environment. Watch what you paint your rooms. You really don't want the rooms painted bright fluorescent colors. Soft beiges again, soft grays are very nice colors. Watch your patterns on the carpeting. You really don't want to put patterns on carpeting. Okay, got to put my glasses on. Do you have any plans to make the overlays into a larger size to make them available to use on the computer screen? No need to do that. You just take 2 or 3 overlays, put them side by side, cut it to size, and put it on the computer, and it looks like you have one overlay. And because you can use and just do it that way, there was no need for us to manufacture various size overlays for various size computer screens. So just take and use more than one overlay and do that. Okay, let's see. Could you mention the Amen Clinic? With TBI and working with, yes, I can mention the Amen Clinic in glowing terms. In a lot of ways. The Amen Clinic is, I refer people to the Amen Clinic, they refer people to me. There is typically, and I kind of talk about this when I'm dealing with anxiety, panic disorder, certain psychological problems, ADD and ADHD, that there's a tendency that we medicate based on the physician's personal preference. It's done by a trial and error method, that if one medication isn't working, we either increase the dosage or we add another medication to it. It really is not a very systematic way of determining what medication. What they do at the Amen Clinic is they use SPECT scans and they look at the brain and they can tell what areas are overactive, what areas are underactive. And based on that scan and that profile, they're able to determine what medication should be prescribed for the individual. And that's especially important if you're dealing with individuals where you keep switching medications because nothing's working. They have negative reactions to medications because it's not working. You're on multiple medications, and maybe you don't need to be on multiple medications. In addition, they're going to talk to you about natural herbs and other things that you can use to enhance your brain functioning. I would suggest that you get a hold of any of Amen's books, Change Your Brain, Change Your Mind. He has some very new ones out there, or watch his specials on PBS. You will learn a lot. Okay? Is the method of screening being used anywhere in San Diego? If you get onto the website and you check on clinics, you will find that we do have a clinic in San Diego and we have screeners in San Diego. So yes, you have somebody close by in San Diego. Otherwise, you can always come up to Long Beach and get tested in Long Beach. If you stop wearing the Irlen filters, do the problems escalate beyond what they experienced earlier? No, they don't escalate beyond it, but because now you know what it's like not to have to deal with those problems, they seem worse to you. I've had people come in who have said, you know what, I didn't realize that I just deal with this low-grade headache, but I dealt with it, so I ignored it. But once I got my filters, so wonderful not to have a headache anymore. And then when I take off the filters, it comes back, and now I'm really more aware of it because I know my life doesn't have to be like this, and I don't have to suffer and struggle this way anymore. But no, it doesn't make it worse. Okay, let's see. Once you use the filters, does it calm the brain down so that the kids may not need the filters or overlays as much? Our tracking, over what now, 30 years? I kind of hate to admit how old I am. But what we have seen is that for 20% of the population who use overlays and Irlen filters, that at some point they don't need to use them anymore. And you can't predict who it is and who is going to happen to, but 80% need to continue to use them for a lifetime. So there are some, and I don't, we've always wondered is if we get and work with these children early, if that's going to make a difference, and it doesn't seem to be the age, and again, it's the brain, and it's pretty unpredictable. And yes, we have somebody in Alberta, Canada. I have 120 clinics and 7,000 screeners, so there is a likelihood that there is somebody near you. If you get onto the website, they'll tell you. And we are in many, many countries around the world. So you don't have to be in the U.S. to make yourself available of this technology, especially because it's hereditary, and you may have family members living in other states or in other countries. It's interesting. I'll tell you a little story about how this all came about. There was someone who got, the head of the adult learning disability program in San Luis Obispo, when I was at Cal State Long Beach, came down and got trained so he could help his students, adult students who were in his program. He then went over to Hong Kong to do research and brought the method with him, and met there an Australian reporter. Now this is getting convoluted, who had a child who had dyslexia and decided to bring the child to the States to get tested by me. And saw, once we put the child in the Irlen filters, saw his child read and just sit down and read for the very first time. His best friend happened to be the head of Channel 9 for Australian television. And they have a show called 60 Minutes, but it's Australian 60 Minutes. And he went back and they wrote the script and actually did, the show appeared in 1985 in Australia. It had the largest response of any show to that date in Australia. It was then showcased, and it went from Australia, obviously, where next? England and New Zealand, because everybody had relatives, and then we had shows on the BBC. So both the media and the people then spread the word. We did a show on Irlen syndrome here in the U.S. in 1987, and it was repeated in 88. It had, again, the largest response in the history of 60 Minutes at that time. We actually flooded all the phone lines coming into California and just shut down the whole system. Let's see. Hi, Helen. Hi, Denton. Denton has, do I share? You've probably been an Irlen screener for what, 30 years now. We've grown old together. And he's asking if he can have copies of the research papers that have been done relative to Irlen filters. Yes, they are available. We have a few of them, especially the brain research studies are online. So again, if you get onto the website, you can look at and download some of those. Otherwise, you can request them. And I'm thinking there is a paper describing how the early research was done in the early 80s. Yes, there is a research paper talking about what happened in the 1980s. And both my books, Reading by the Colors and The Irlen Revolution, go into that as well in detail. You want to have normative data from which the eye doctors can ply their trade. Left out a group that were like when you were describing. Oh, yeah, okay. Let me see if I'm kind of answering it. What I didn't say, and I guess I should have, is when we worked with the first group of adults and they were reporting the distortions and the discomfort, and they now have the language to describe what was happening to them. My first issue is there has to be another profession or another technology out there that can help or change this problem. It's just that the people haven't been able to report it. So we had optometrists, ophthalmologists, developmental optometrists, neurologists, reading specialists, and psychologists work with each one of these 35 adults for 9 months. And any method or any glasses or medication that needed to be prescribed was prescribed and tried. At the end of the 9 months, though, I had 35 adults with the same problems and the same complaints. And it wasn't until we were able to show that there wasn't a method out there that could address the specific type of sensory overload that I then went ahead to look at what else can we do and how can we make things better for this population. Okay. David, I'm not seeing that there are any other questions. Am I right? So, what I want to do then is thank you all for being here and this amount of time, and I'm going to let David end and sign off.
Okay, thank you so much, Helen. We do have a few more questions coming in, but they just keep piling in. We've gone over 200, close to 200. Let me see now. Golly, 216 questions. I'll tell you what I've done, folks. We might have to wrap it up now, but obviously Helen is going to come to attend to do more presentations, really, to help cover all these different topics. I never knew this was such a big issue here. Looks like we have opened a geisha here. All right, thank you, Helen, for this great info. Lots of questions coming in. I'm going to give you guys a tip. If you go to our website and then you click on the banner, you can actually click on the banner, and then that will open a comments box. And I would really encourage you to go to our website, click on Helen's banner, and then enter your questions and comments, and then she and the other Irlen diagnosticians can read your questions and answer them at their own convenience. We just can't go over all the questions tonight because they just keep on piling in, and I think it's best if you just go ahead and type the questions in the comments box. And of course, like I said, we'll be having Helen coming back to do several more presentations. Now, Shoshana, who is also an Irlen diagnostician, and also, let me just get her picture up. I had mentioned this earlier on before. She will be doing a presentation on traumatic brain injury and the Irlen Method. Obviously, she's going to use other methods as well, but talking about that on the 28th, that's in March, 2 weeks from today, I believe, to address that. She also mentioned there are some DVDs that are available, one on visual stress and learning disabilities, then this one on visual stress and migraines, and of course, if Helen allows us to, we shall make a DVD of this presentation and make that available as well. CEU's questions came in with regards to CEU's continuing education credits. Shoshana says you can go to AOTS or email at info@aotss.com, and these that's info@aotss.com, and the CEUs will be available for occupational therapists, OTAs, I don't know what that means, and then social workers. So if you do want to get credit hours for those, just email Shoshana and she will take care of that. Helen has DVDs of clients on her website and on YouTube.com. So I guess you just need to type in Helen Irlen, and then someone says they can't hear me, and then you can watch the YouTube's videos and all that. And again, she has DVDs there. My goodness, this is so much information. Helen, you've got to listen once a week. Let's do that. Let's try once a week. Probably even once every other day, because you've got so much information pour out. Thank you so much for doing this for us. And you mentioned Amen Clinics and your work with them. Now you mentioned some of his books, and I just want to point to this one specifically. He's making his Change Your Brain, Change Your Life program, which includes his DVD, CD, and books at a 15% discount to all webinar attendees. And actually, you can go to his website, which is amenclinics.com, I believe, amenclinics.com, and you can type in ANNCYLOL01, or just email us and we can give you the code. You can also get the Children's Brain Health series, which covers autism, and by other doctors. Again, we're giving you a whole 360-degree viewpoint and on the whole issue of those brain learning difficulties. Okay, any more things coming in? Again, please go back to our website and put in your comments and questions, and then we will surely let Helen know about them as well. Is there a way to get proof of attendance? I need it for my school. Well, if you registered, yeah, we can just send you. I mean, we can check your name, make sure that it checks out, and then I guess I don't know what you want. Maybe a letter, a mail letter. You can send us an email. We'll try and take care of it for you. Okay, I think this wraps it up for tonight. Again, you can order the replays above my video by clicking on the banner above my video, and that takes you to the webinar site. Helen, thank you again, and I'll be calling you in a few minutes. All right, God bless everyone. Have a great evening. Bye.